Good day everyone, we are the group 4 and today we're going to discuss about the phases of wound healing and I am your reporter Angel Solana. The 4 stages of wound healing. When skin is injured, there are 4 phases of wound healing that take place. Hemostasis, inflammatory, proliferative, and maturation. The first phase, which is the hemostasis phase. It is the process of the wound being closed by clotting. Hemostasis starts when blood leaks out of the body. The second phase, which is inflammation. During the inflammatory phase, damaged cells, pathogens, and bacteria are removed from the wound area. The third phase is proliferation. The proliferative phase of wound healing is when the wound is rebuilt with new tissue made up of collagen and extracellular matrix. And the last phase, which is the remodeling. Remodeling, or also known as maturation phase, is the fourth and final phase in wound healing and lasts from 21 days up to 2 years. To further illustrate the phases of wound healing, imagine that you accidentally cut your finger with a knife as you were slicing an apple. Immediately after the injury occurs, blood vessels constrict and clotting factors are activated. This is referred to as the hemostasis phase. Clotting factors form clots that stop the bleeding and act as a barrier to prevent bacterial contamination. Platelets release growth factors that alert various cells to start the repair process at the wound location. The hemostasis phase lasts up to 60 minutes depending on the severity in the wound. And the next one is the types of wound healing. There are 3 types of wound healing: first intention, second intention, and third intention. So, the first one is the first intention or the primary intention. So, healing by primary intention means that the wound is sutured, stapled, glued, or otherwise closed so the wound heals beneath the closure. The second one is the secondary intention. The examples of wounds that heal by secondary intention are pressure injuries and chainsaw injuries. Wounds that heal by secondary infection are at higher risk for infection and must be protected from contamination. And lastly, the tertiary intention. Tertiary intention refers to a wound that has had to remain open or has been reopened, often due to severe infection. The wound is typically closed at a later date when infection has resolved. Wounds that heal by secondary and tertiary intention have delayed healing times and increased scar tissue.
Hello everyone, my name is Janelle Marie Isabel Pena and I will report about wound closure and common types of wounds. What is wound closure? The clinicians care for wounds ranging from minor and simple lacerations or abrasions to complex wounds. Wound closure techniques have evolved significantly and now range from simple sutures to adhesive compounds, and techniques have also improved. For injuries that require further management, it is imperative to assess the wound and determine how best to treat it. There are 3 types of wound closure: staple, sutures, and adhesive. What is staple? For many minor wounds, suture are the gold standard method for closure. In a case where you have a linear laceration located on the scalp or extremities, it is a responsible alternative to use staples. The advantage is that they can be placed quickly. This is immensely useful in situations where there is brisk bleeding and in mass casualty settings where there are multiple wounds to which to attend. They are also widely used to close postoperative incised wounds. Staples are cost effective, easily placed, require minimal training, and have similar healing times and infections rates as sutures. What is sutures? The choice of suture and technique depends on the type of wound, depth, degree of tension, and desired cosmetic results. Simple interrupted sutures have the advantage of more cosmetically appealing results. as the use of separate stitches allows for a better approximation of the skin and fascia. They provide greater tensile strength and have less risk of injuring cutaneous circulation. Also, in the case of an infection, the entire length of sutures would not need to come out. What is adhesive? In percutaneous wounds or simple pediatric cases, skin glues are particularly useful as they are quick and relatively painless. Adhesive tapes and skin glues are a useful adjunct to deeper sutures too. They are cause minimal wound inflammation, have a lower infection rate than sutures, and are removed easily. There are common types of wounds. For example, skin tear and venous wound. What is skin tear? Skin tears are wounds that may look like large cuts or scrapes. They're considered acute wounds. This means they occur suddenly and typically heal in unexpected fashion over time. However, for some people, skin tears can become complex, chronic wounds. This means they have trouble healing. Skin tears may be partial thickness. That's when the top layer of the skin separates from the underlying layer. They may also be full thickness. That's when both epidermis and dermis separate from the underlying tissues. This type usually occurs on the arms, back of hands, and elbows where the skin is thin. What is venous ulcers? Typically occur because of damage to the valves inside the leg veins. These valves control the blood pressure inside the veins. They allow it to drop when you walk. If the blood pressure inside your leg veins doesn't fall as you're walking, the condition is called sustained venous hypertension. That increase in blood pressure causes ulcer to form on your ankles. Venous ulcers need proper care and treatment to prevent infection and to heal. It's important to have any venous ulcer checked right away by your healthcare provider.
Arterial ulcer is a type of ulcer caused by a lack of blood supply to the affected area, ischemia. Arterial ulcers commonly affect the lower legs and feet, and they can be acute, recurring, or chronic. Ulcers can be caused by a variety of reasons, and mixed ulcers account for about 15% of all legs ulcers. Diabetic ulcer is an open sore wound that affects about 15% of diabetic people and is mostly typically found in the bottom of the foot. 6% of people who get a foot ulcer will end up hospital owing to infection or another ulcer related problem. Pressure injuries. Sores, ulcers that occur on parts of the skin that can under pressure are known as pressure injuries. Pressure can be caused by lying in bed, sitting in a wheelchair, or being in a cast for an extended period of time. Bed sores, pressure sores, and decubitus ulcers are all terms for pressure injuries.
Several factors place a patient at risk for developing pressure injuries, including nutrition, mobility, sensation, and moisture. The Braden scale is a tool commonly used in healthcare to provide an objective assessment of a patient's risk for developing pressure injuries. The six factors included on the Braden scale are sensory perception, moisture, activity, mobility, nutrition, and friction or shear. And these factors are rated on a scale from 1 to 4, with 1 being completely limited to 4 being no impairment. The scores from the six categories are added, and the total score indicates a patient's risk for developing a pressure injury. Ranges of scores indicate mild risk for scores 15 to 19, moderate risk for scores 13 to 14, high risk for scores 10 to 12, and severe risk for scores less than 9. Nurses create care plans using these scores to plan interventions that prevent or treat pressure injuries. Next are the four stages of pressure injuries. Stage 1. Pressure injuries are intact skin with a localized area of non-blanchable erythema where prolonged pressure has occurred. Non-blanchable erythema is a medical term used to describe skin redness that does not turn white when pressed. Stage 2. Pressure injuries or partial thickness loss of skin with exposed dermis. The wound bed is viable and may appear like an intact or ruptured blister. Stage 2 pressure injuries heal by reepithelialization and not by granulation of tissue formation. Stage 3 pressure injuries are full thickness tissue loss in which fat is visible but cartilage, tendon, ligament, muscle, and bone are not exposed. The depth of tissue damage varies by anatomical location. Undermining and tunneling may occur in stages 3 and 4 pressure injuries. Undermining occurs when the tissue under the wound edges becomes eroded, resulting in a pocket beneath the skin at the wound's edge. Tunneling refers to passageways underneath the surface of the skin that extend from a wound and can take twists and turns. Slough and eschar may also be present in stages 3 and 4 pressure injuries. Slough is an inflammatory exudate that is usually light yellow, soft, and moist. Eschar is dark brown, black, dry, thick, and leathery dead tissue. If slough or eschar obscures the wound so that tissue loss cannot be assessed, the pressure injury is referred to as unstageable. In most wounds, slough and eschar must be removed by debridement for healing to occur. And lastly, stage 4 pressure injuries are full thickness tissue loss like stage 3 pressure injuries, but have exposed cartilage, tendon, ligament, muscle, or bone. Osteomyelitis or bone infection might be also present. Let's now proceed to the factors affecting wound healing. Multiple factors affect a wound's ability to heal and are referred to as local and systemic factors. Local factors refer to factors that directly affect the wound, whereas systemic factors refer to the overall health of the patient and their ability to heal. Local factors include localized blood flow and oxygenation of the tissue, the presence of infection or a foreign body, and venous sufficiency. Venous sufficiency is a medical condition where the veins in the legs do not adequately send blood back to the heart, resulting in a pooling of fluids in the legs. Systemic factors that affect a patient's ability to heal include nutrition. Nutritional deficiencies can have a profound impact on healing and must be addressed for chronic wounds to heal. Protein is one of the most important nutritional factors affecting wound healing. For example, in patients with pressure injuries, 30 to 35 kilograms of calorie intake with 1.25 to 1.5 grams of protein and micronutrient supplementation is recommended daily. In addition, vitamin C and zinc deficiency have many roles in wound healing. Systemic factors that affect a patient's ability to heal include nutrition. Nutritional deficiencies can have a profound impact on healing and must be addressed for chronic wounds to heal. Protein is one of the most important nutritional factors affecting wound healing. For example, in patients with pressure injuries, 30 to 35 kilograms of calorie intake with 1.25 to 1.5 grams of protein and micronutrient supplementation is recommended daily. In addition, vitamin C and zinc deficiency have many roles in wound healing. Stress. Stress causes an impaired immune response that results in delayed wound healing. Although a patient cannot necessarily control the amount of stress in their life, it is possible to control one's reaction to stress with healthy coping mechanisms. Next is diabetes. Diabetes causes delayed wound healing due to many factors such as neuropathy, atherosclerosis, or a buildup of plaque that obstructs blood flow in the arteries, resulting in decreased oxygenation of tissues, a decreased host immune resistance, and increased risk for infection. Age. Older adults have an altered inflammatory response that can impair wound healing. Obesity. Obese individuals frequently have wound complications including infection, dehiscence, hematoma formation, pressure injuries, and venous injuries. Medications. Medications such as corticosteroids impair wound healing due to reduced formation of granulation tissue. When assessing a chronic wound that is not healing as expected, it is important to consider the side effects of the patient's medication. Alcohol consumption. Research shows that exposure to alcohol impairs wound healing and increases the incidence of infection. Patients with impaired healing of chronic wounds should be educated to avoid alcohol consumption. And lastly, smoking. Smoking impacts the inflammatory phase of the wound healing process, resulting in poor wound healing and an increased risk of infection. Patients who smoke should be encouraged to stop smoking. That's all. Thank you.
I am Karel C. Sumael and today I will discuss about lab values associated with delayed wound healing and wound complications. Lab values are used to determine a patient's overall health and well-being. There are many factors that can affect a patient's result and lab values, but some of the most common factors are gender, age, race, the medicines taken, and the presence of any underlying conditions. Important parameters to evaluate include protein levels, complete blood count, erythrocyte sedimentation rate, liver function tests, glucose and iron levels, total lymphocyte count, blood urea, nitrogen and creatinine levels, lipoprotein levels, vitamin and mineral levels, and urinalysis. These are the abnormal lab values and the rationale. First is the low hemoglobin. It indicates less oxygen is transported to the wound site and can also lead to blood loss, which can occur because of bleeding in your digestive tract, such as from ulcers, cancers, or hemorrhoids, and frequent blood donation. Second is the elevated white blood cells. It increased white blood cells indicates infection is occurring. A high white blood cell count may indicate that the immune system is working to destroy an infection. It may also be a sign of physical or emotional stress. Third is the low platelets. These are important during the proliferative phase in the creation of granulation tissue and angiogenesis. Platelets aid in the prevention of blood loss at vascular injury sites. They achieve this by adhering to each other, aggregating, and forming a procoagulant surface that promotes thrombin production and fibrin formation. Next is the low albumin. It indicates decreased protein levels. Protein is required for effective wound healing because it can also mean that you have liver disease or an inflammatory disease. Next is elevated blood glucose or hemoglobin A1C. Is a sign of diabetes, a chronic condition that can cause serious health problems, including heart disease, kidney disease, and nerve damage. Elevated blood glucose and hemoglobin A1C levels indicate poor management of diabetes mellitus, a disease that impacts wound healing. Fifth is the next is the elevated serum bond and creatinine high bond or blood urea nitrogen. Ratios occur with sudden, acute, or kidney problems which may be caused by shock or severe dehydration. Bond or Blood urea nitrogen and creatinine levels are indicators of kidney function, with elevated levels indicating worsening kidney function. Elevated bone or blood urea nitrogen levels impact wound healing. Lastly, positive wound culture is a wound culture that tests to find germs such as bacteria or a fungus that can cause an infection. A sample of skin, tissue, or fluid is added to a substance that promotes the growth of germs. If no germs grow, the culture is negative. If the germs that can cause an infection grow, the culture is positive. Wound complications. In addition to delayed wound healing, several other complications can occur. Three common complications are the development of a hematoma, infection, or dehiscence. These complications should immediately be reported to the healthcare provider. Hematoma. Hematoma is a bad bruise. It happens when an injury causes blood to collect and pool under the skin. The pooling blood gives the skin a spongy, rubbery, lumpy feel. A hematoma usually is not a cause for concern. It is not the same thing as a blood clot in a vein, and it does not cause blood clots. Infection. The invasion and growth of germs in the body, that the germs may be bacteria, viruses, yeast, fungi, or other microorganisms. Infections can cause or begin anywhere in the body and may spread all through it. An infection can cause fever and other health problems, and these are fever over 38 degrees Celsius, overall malaise or lack of energy and not feeling well, change in level of consciousness or increased confusion, increasing or continual pain in the wound, expanding redness or swelling around the wound, loss of movement or function of the wound area. Wound complications. In addition to delayed wound healing, several other complications can occur. Three common complications are the development of a hematoma, infection, or dehiscence. These complications should immediately be reported to the healthcare provider. Hematoma. Hematoma is a bad bruise. It happens when an injury causes blood to collect and pool under the skin. The pooling blood gives the skin a spongy, rubbery, lumpy feel. A hematoma usually is not a cause for concern. It is not the same thing as a blood clot in a vein, and it does not cause blood clots. Infection. The invasion and growth of germs in the body, that the germs may be bacteria, viruses, yeast, fungi, or other microorganisms. Infections can cause or begin anywhere in the body and may spread all through it. An infection can cause fever and other health problems, and these are fever over 38 degrees Celsius, overall malaise or lack of energy and not feeling well, change in level of consciousness or increased confusion, increasing or continual pain in the wound, expanding redness or swelling around the wound, loss of movement or function of the wound area. Dehiscence. Dehiscence refers to the separation of the edges of a surgical wound. A dehisced wound can appear fully open where the tissue underneath is visible, or it can be partial where just a portion of the wound has torn open. Wound dehiscence is always a risk in a surgical wound, but the risk increases if the patient is obese, smokes, or has other health conditions such as diabetes that impact wound healing. Additionally, the location of the wound and the amount of physical activity in that area also increase the chances of wound dehiscence. That's all. Thank you. Dehiscence refers to the separation of the edges of a surgical wound. A dehisced wound can appear fully open where the tissue underneath is visible, or it can be partial where just a portion of the wound has torn open. Wound dehiscence is always a risk in a surgical wound, but the risk increases if the patient is obese, smokes, or has other health conditions such as diabetes that impact wound healing. Additionally, the location of the wound and the amount of physical activity in that area also increase the chances of wound dehiscence. That's all. Thank you.